Good day, ma'am. I am Jilvi Carreso, the student nurse from Our Lady of Fatima, Pampanga, who will be having a return demonstration in administering a post-mortem care to the deceased patient. First is I will check the physician's certification of the death of the patient because the physician is the only one who can declare if the patient is already dead. Second is I will ask permission and explain the procedure to the significant others. I will also consider the culture and religious belief of the deceased patient. Sir, since I will be the student nurse that will administer the postmortem care to your deceased family, sabihan niyo lang po ako if you feel any disrespectful things sa religion niya na magagawa ko pa. And third is, I will prepare the equipment. My equipment I have is the alcohol, the gloves, the basin, the towel, the cravat, and the dry towel. Fourth is, I'll ask the family if they want to stay because you will be needing the decision of the family. Gusto niyo po bang magstay or umalis po as I having a postmortem care? Okay po, thank you po. And fifth is, I will provide a privacy. I will now close the curtains or rather close the doors to provide the privacy. Sixth is, I will pour lukewarm water to the bedside. Here po is in the bedside. I will wash and dry my hand before and put my gloves. Since I already wore my gloves, I will now remove the personal items of the patient and give it to the family. So you will not be charged of them. So I will check. Since umalis na po yung family, I will only keep it and record what are the items that I've found to the patient. And next is I will close the patient's eyes and mouth for respect. And next is I will form a mitten. And here is the basin. I will be performing a circular stroke from forehead of the patient. Next is the eyes, cheeks, and nose. In performing this, you will start in the least to the most contaminated area. Next is, I will put a cotton balls to the patient's eyes, nose, ear, and I will secure it with tape. But in this, I will just be giving the patient's cotton to her eyes. Next is I will secure the patients with cravat. And secure it with pin. I will also assume that we remove the patient's clothes. Next is I will perform a bed bath to prevent discoloration. In performing a bed bath, we only need to expose the patient's part where we will be providing a bed bath. Assume that I've already have a bed bath to her both arms and legs. Now I will be put the patient's new clothes and drape her. After doing it, give a family option if they want to view, but since the family is already in the outside, so they finally said her goodbyes. But I will also remove the bath blanket. Without exposing the patient's body. I will put a name tag sa hand and foot ng patient, but this time I will only put to the foot of the patient. And now, I will be cover the patient with shroud and secure it with pin. Then I will remove the pillow and continue to cover the patient up until to her head. I will discard all the materials that I've used, remove my gloves, and perform a hand hygiene. I will document all things I do, especially with my name and the nurse name, and especially the signature. I will pray for the soul of the patients and pay respect also to the family by giving a condolences.